Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
best use of lithium is best used in prevention of recurrence in bipolar mood disorder. In this we use lithium. So for the treatment of schizophrenia, actually clozapine can be used for treatment of schizophrenia if it is resistant, or we can start the patient with haloperidol also, and once he develops negative symptoms, or if he does not respond to haloperidol, then we can switch the patient to clozapine. Treatment of recurrent depression. If the patient has recurrent depression, we can give the patient antidepressants. Even in first episode, depressive episode, you will give antidepressant. But one important thing is the antidepressants are given according to their side effect profile. So if you see, the best antidepressants that can be given is first line is SSRIs because of lesser side effects. Then lithium is mainly used for the prevention of recurrence of bipolar disorder.
thank you and thank you for watching.